A very good evening to all of you. Myself, Dr. Prateek Garg, your ENT educator. Today we will study about acute mastoiditis. So by definition, we all know itis means inflammation, mastoid means mastoid bone. So it is an acute inflammation of the mastoid bone. So let's start with the question. My first question is identify the space below. So we have to look at this space, which is this space. The space shown here. So examiner want to ask, identify the space below. The options are Prusak space, sinus tympani, epitympanum and facial recess. So the correct answer is Prusak space. What is this Prusak space? Prusak space is a space which is just above the neck of malleus. You can see this is my malleus bone and this is the neck of the malleus. Above the handle of the malleus, this is my handle of malleus. So above the neck of the malleus, superiorly Prusak space is bounded by this pars flaccida, or we can say this scutum, the bony part of the mastoid, roof of the mastoid. And medially, or we can say superiorly, there is lateral ligament, lateral malleolar ligament. So we will discuss it in the next slide. Let's talk about other option. Option number B is sinus tympani. Option number D is facial recess. So we know this facial recess is an area or space lateral to the vertical part of the facial nerve. Suppose in the middle ear my facial nerve goes like this. So a space lateral to this area is my facial recess, and space medial to vertical part of the facial nerve is my sinus tympani. And epitympanum, option number C, is this part, that is the area opposite to the pars flaccida above the mesotympanum. Now this is a diagram showing the Prusak space. You can see this circle marked is the Prusak space. What are the boundary? I already told you that inferiorly, or the base is formed by the neck of the malleus. Then comes laterally comes the pars flaccida or the Shrapnel's membrane. Medial is the neck of the malleus. Inferiorly there is short process of the malleus. This is my short process of the malleus. And superiorly there is lateral malleolar fold. This is my lateral malleolar fold, lateral malleolar ligament. I'll mark it with the blue, and the structure shown here in the white color. So I will mark it with the blue. So this is my lateral malleolar ligament. Again, this is an examination important point. It has been asked previously on the boundaries of the Prusak space. And what is the importance of this Prusak space? It is the most common site of origin of cholesteatoma. Okay. Now my next question is, middle ear infections are known to spread to the adjacent area via all of the following routes except. So what examiner want to ask is, suggest the routes or the pathways from which the middle ear infection can spread to adjacent or adjoining area. So all these seems to be correct option except the one. So we have to rule out the exception. Direct bony invasion, yes, it is there. Direct bony invasion always happen in form of cholesteatoma and in form of the granulation or infection. The pus point can spread. Because we all know mastoid cavity is an aerated. There are air spaces in the mastoid cavity, so direct bone invasion is possible. Then comes the oval or round window. Yes, sometimes acute otitis media, chronic otitis media, by means of route of spread of infection through the oval or round window, it will lead to the acute labyrinthitis, which will lead to the presence of symptoms like vertigo, tinnitus. Okay. Then comes the venous thrombophlebitis. Yes, we all know, we have read about the sigmoid sinus thrombophlebitis, venous thrombophlebitis. Through the emissary vein, these infections or the thrombus clot may spread to the sinuses. So again, this is a route for infection. Then comes the lymphatic spread. I don't think there is any lymphatic spread in the middle ear, because there is not lymphatic drainage is not of much concern. So the correct answer for this question seems to be lymphatic spread, because middle ear infection doesn't spread via lymphatic route. Now question number 3 is most common extracranial complication of ASOM, that is acute suppurative otitis media, is. So what is the most common extracranial? That means the cranial cavity is not involved. Facial paralysis, yes, it do happen. Lateral sinus thrombosis, yes, it also do happen. Brain abscess, firstly the brain abscess is an intracranial complication, so we directly rule out this. Then comes the mastoiditis. We all know the mastoiditis is the most common extracranial complication of ASOM, because inflammation of mastoid bone is the first complication which happens in acute suppurative otitis media, and then later on there may be lateral sinus thrombosis or facial nerve paralysis. So the correct answer for this question is mastoiditis, option number C. So let's talk about mastoiditis. What is mastoiditis? So acute mastoiditis, it is the most common extracranial, that means into the ear only, the not involving the brain. So it is most common extracranial intratemporal, that is resides into the temporal bone cavity. Complication of the acute otitis media. Yes. So it is the most common extracranial intratemporal, that means the complication which resides in the temporal bone. So most common organism is Pseudomonas. Most common organism is Streptococcus pneumoniae. It is the most common. Then further it is followed by the Staph aureus, Haemophilus influenza, or Pseudomonas moraxilla, Catarrhalis moraxilla, etc. But the most common organism is Streptococcus pneumoniae. You have to remember this point. Very, very important, asked multiple times into the exam. So what are the symptoms of acute mastoiditis? Firstly, patient will feel the pain in the ear. There may be the discharge from the cavity. And if it's the acute mastoiditis, so maybe in the post-oral region, there may be some bulging, there may be some tenderness. So what are the symptoms? And patient may have the fever, pain behind the ear discharge, which is the most common, and ear discharge may be the profuse or persistent discharge. Profuse means very large in the cavity, very large in the quantity, because mastoid bone is involved, so there is a big space for the pus to get collected. So what are the signs? The first sign is tenderness in the mastoid region in the area of Mac-Evans triangle. What is the Mac-Evans triangle? We know, suppose this is my external auditory canal, it is round in structure, and suppose it is my supratemporal crust. So I'll mark the Mac-Evans triangle. If we draw a tangential line at the posterior superior quadrant of the EAC, and superior it is bounded by the suprameatal crest, and then a line joining these two. So this is my Mac-Evans triangle, which is a posterior superior region at the level of the external auditory canal. And this is an area as a landmark for the mastoid antrum. So there will be tenderness at this area in the Mac-Evans triangle, which is the most common sign. And then comes the sagging of the posterior superior meatal wall. Sometimes if you look at the external auditory canal, suppose this is my external auditory canal and this is my posterior superior region. So because of the pus collection, there may be sagging. What do you mean by sagging? So this will little bit lower down. This will, like, hanging in the external meatus. So we will see in the posterior superior region, there may be some sort of swelling in the posterior superior region. That is known as sagging of the posterior superior meatal wall. Then there may be perforation of the pars tensa. Obviously, tympanic membrane will get perforated, and as a result of that, the mastoiditis may happen. And then comes the swelling of the pinna. Suppose there is a pus collection in the mastoid cavity, what it will do? So it will push our pinna forward in downwards. And this retroauricular sulcus just behind the sulcus behind this pinna, retroauricular sulcus may get obliterated. So there will be appearance known as ironed out. There is no creases. Okay, so this crease will be absent. So appearance will be ironed out appearance of the mastoid, which is the first sign of acute mastoiditis, point to remember. Then what is a positive reservoir sign? Suppose patient is having mastoid abscess or acute mastoiditis. So if you try to suction out the pus from the external auditory canal, again it will get refilled because there is big collection of the pus into the mastoid cavity. So if I suck this pus from the external auditory canal, so again from the mastoid cavity, more pus will come into the picture. So this is known as positive reservoir sign. That means there is a big reservoir of the pus. So again, this is an important examination question asked in the exam. Now, what do you mean by sagging of the external auditory canal? Hallmark sign. I have explained you. If you look in the external auditory canal, there will be the bulging or the dropping out of the posterior superior meatal wall. And as you can see in this picture, there is ironed out appearance. There is no retroauricular sulcus or any sort of crease we can see in this diagram, and there is collection, there is some edema in the mastoid region. What will be the hearing loss? Hearing loss will be the conductive type. Obviously conductive because it is a disease of the middle ear, not involving the inner ear right till now. So hearing loss will be conductive. And X-ray, if we do the X-ray mastoid, that is a sculler's view, what we prefer for to do the mastoid. So there will be mastoid air cell clouding, or we can say sclerosis in the longer term, but there will mastoid air cell clouding. That we can't appreciate the separate dot air filled spaces. So there will be clouding. I mean, there complete blurring of the mastoid air cell because the bony septa, because of the inflammation, get destroyed, and there will be collection of the pus, leading to the clouding of the mastoid air cell. And so what is the surgery or the treatment for the acute mastoiditis? Is the Schwarz operation, or in simple words, it is also known as cortical mastoidectomy. Again, this has been asked, what is a Schwarz operation? Schwarz operation is in cortical mastoidectomy, where in which we open up the mastoid bone by using the drill, and we clear out all the pus or the inflammatory process. Now, let's look about the abscesses which are related to the mastoiditis. So this is a diagram. Suppose this is my external auditory canal. This is my external auditory canal, and this bone is a tympanic bone, which I'm marking in the red. This is my tympanic bone. This seems to above one. This seems to be my zygomatic bone. Zygomatic bone is this. So there are multiple abscesses. The most common abscess because of the mastoiditis is the post-auricular abscess. This is my post-auricular abscess, which is just behind the abscesses. Then there comes other abscess, which is the basalt abscess or Sitelli abscess. These two has been asked multiple times in the exam. So basalt abscess, look at this diagram. This is my basalt abscess. So basalt abscess is the abscess of the collection of the pus which drain out along the direction of sternocleidomastoid muscle. As we know, sternocleidomastoid muscle is attached medially to this mastoid tip. So basalt abscess, when the pus passes through the mastoid tip and drained out or lower down through the sternocleidomastoid, and it is mostly presented as an swelling in this area, which is known as upper neck swelling, or we can say deep to the sternocleidomastoid muscle. So basalt abscess, point to remember, drain out along the mastoid tip. Then there occur another abscess which comes known as Sitelli abscess. So I remember by this that C and D, after C comes D. So this is how you can memorize it. So Sitelli abscess is an abscess which is draining along the digastric triangle by means of C and D, because D comes after C. So Sitelli abscess is an abscess which is along the digastric triangle. And then comes the Lux abscess. What do you mean by Lux abscess? Lux abscess is an abscess which spread into the meatus. This is my Lux abscess. Look at the arrow. So this is my external auditory canal. So between the bony wall and the skin, or we can say the mucous membrane. So this is skin and bony wall. So abscess between the skin and bony wall, that is known as Lux abscess. Again, this is very common. Sometimes for uncle also happen in this area. So Lux abscess is the meatal abscess. This has been important. Then comes the zygomatic abscess. You can see where is the zygomatic abscess. This is my zygomatic abscess showing. So along the zygoma, we know this is a zygomatic process attached here. So along the zygoma, if the abscess is there, that is known as zygomatic abscess. And other abscesses are parapharyngeal or retropharyngeal.